All right. So we are live, and thank you all very much for joining us today for episode 19 of the InnerStrength Empowerment Hour. I am Lori DePietro stand-in, and I am so happy to have you here today with some of my coaches and clients. So if you guys just want to introduce yourselves.
I'm Joanne. I'm one of the coaches.
Yeah, Joe, everybody knows Joanne.
Everybody knows me.
Joanne's one of my success coaches.
Hi, I'm April. I'm one of Lori's clients.
Yep, and April is also a new coach, and she has been running our Couch to 5K group inside the Plant Power Army, which has been amazing.
I'm Linda. I'm a client.
Yep, and Linda has known me for a while now, but did not join on until what, last year sometime? Is that what it's been?
It was in, I believe, the end of November of 2019.
Okay, so a little over a year.
Yeah, right before the pandemic.
Yeah, exactly. That's awesome. Okay, great. So today what we want to talk about is just the amazing things that can happen when you take on a plant-based diet. And, you know, when I talk about these testimonials, it really is startling. And I think that a lot of times people would not believe it. And especially when I, tell people ahead of time that this can happen, it's, I think they're skeptical because there are so many programs out there making huge promises. And of course, no one can promise you results. I mean, let's be honest, even a doctor, if you come in, can't, they make you sign all sorts of things so that they don't have to actually promise you a result. But when you see these results over and over again from a plant-based diet, and specifically from my program, it is just amazing. And it's why I do what I do, even more so than the weight loss, because people are losing weight. Obviously, I post those testimonials all the time as well. But more importantly, they're getting their lives back through a plant-based diet. They're getting their health back. And that is what is really makes it worth it. I tell people all the time that, I mean, everybody wants to look good, right? I mean, there's no one out there who's like, no, I don't want to look good. Like that's a thing. But at the same time, it's not what keeps you going. The thing that keeps you going is how much better you feel. That is the thing. And so, you can't beat it with a stick. So it's, I'm so glad to have everybody here. And also Linda D is joining us. So she is also not only one of my clients, but a new success coach as well. And before we get going, Linda, how much weight have you lost on the program?
About 67. Yeah.
Yeah. So yeah, that's amazing. So everyone has had so much success, and so that's, I love having them as part of my tribe, both in the Army and as success coaches. So I wanted to first say a little bit about the reason why a plant-based diet, I've gone into the science about this many, many times. And so anyone who wants more of an explanation, I can tag you in something. But the basis of it is really about gut inflammation. And so what happens when you're on the standard American diet is it is so acidic and so awful for your system, and it causes, among other things, gut inflammation. And that inflammation just leads to havoc in your system. Things like allergies, skin issues, joint pain, chronic fatigue, because your estrogen is actually metabolized in your gut. It can actually cause hormone disruption, both from the gut flora being off and from the fact that your estrogen is metabolized there. So when you don't have a healthy gut, then you're not going to be metabolizing your hormones correctly, and you're going to see just craziness, which is something that many of us of a certain age especially have seen across the board. Although for me, it started when I was 35. I mean, it was just out of control night sweats and just insanity. but almost every woman who comes to me has the same issues. And so we're talking about things like not just being overweight, but people who have high cholesterol, diabetes, thyroid issues, you know, some kind of fertility or reproductive disorder issues or hormonal issues. A lot of people have increased allergies, joint pain. So these are the things I see over and over and over again. And probably, I would say close to half of the women that come to me have already had a hysterectomy or partial hysterectomy. Which is a whole other topic that I could spend an entire session on, and maybe I will do that at some point. But these guys are here to talk about some of the amazing success that they've had in relief from symptoms. And so I hope that those of you who are out there will ask questions and make comments if you like, because I can see your comments. So the first thing, though, I wanted to talk about was hormone disruption, because for many of us, that has been a huge issue. And for, you know, this is a group of all women in the InnerStrength tribe, so we know what that's like. And I know for you, Linda D, that menopause, that this made a huge impact on you. So can you tell me, what were your issues with that before coming into the program?
So I would wake up periodically during the night, maybe like, you know, like at 2 o'clock and 4 o'clock. And then I would just break out in the sweat. And then I would just be like wide awake. It would be really hard to get to sleep and be really stressed out and everything. After I started doing the program, that has all gone away. It doesn't happen anymore.
Yeah, it's amazing. I was having the kind of night sweats that, I mean, I don't know about you, but it like soaked my clothes, soaked the sheets. Like, it wasn't like, oh, I'm a little sweaty. Like, anyone who has night sweats knows it is an epic, like, streaming sweat that is just awful. And it does disrupt your sleep. And so how long do you think it took it for it to completely go away?
I would say it wasn't even a month. It was pretty quick. Yeah.
Yeah. I think, didn't you, Lori, have that same experience? Like, it pretty much stopped right away?
It stopped within the month. I would say really at about the 3-week mark. And I was one of those that absolutely drenched the bed.
Yeah. Yeah. And I hear that from clients over and over again. I mean, that's the thing, is like, that's one of the main thing that happens like towards the beginning, that people are so excited about. So, you know, if it does happen for you, then it's life-changing not to have to be put through that all the time.
Yeah.
And it, you know, for me also, I was, you know, there was no reason for it, but I was embarrassed. You know, I mean, I didn't have any control over it, but it's embarrassing. You know, when the sheets are soaked and your clothes are soaked. I mean, and so, you know, that the whole process of being sick and overweight is just, it makes your self-esteem kind of fall into the crapper. We're getting a lot of loves and likes also, and a lot of good mornings and hellos. So yeah, does anyone else want to say anything about if you were having, I don't know, I actually haven't talked to all of you about this, about hot flashes or night sweats before you were coming into the program?
My hot flashes had started. I had a couple of weeks before I called you.
Yeah, and you told me about this. I forgot. Yes.
Remember,
okay.
I thought I was having a heart attack because
Yes.
it was so intense. I had never experienced it, and I've never had another one since. Yeah. So, and I'm glad, because it was kind of freaked me out.
Yeah. So for those of you who are going into menopause, out in whoever's watching this, it is, or you're in menopause, it definitely can make an impact, because when your gut is healthier, number one, that's automatically your estrogen is going to be metabolizing better. But the other thing is, when you're not pouring a ton of hormonal foods through dairy and meat into your body at a time when your body is trying to stabilize at a new hormonal level, I mean, it just makes common sense as to why, you know, it's such an amazing lifestyle. So also, that the other thing that leads into when you have hormonal disruption is, you know, allergies and, you know, like skin issues. And the reason that happens is, again, the gut inflammation is causing some different, you know, issues in your body, but also your hormones are fluctuating because of the different gut flora in your gut that's actually affecting your hormones. And I just wanted to ask Linda quickly, because I know that this was a huge issue for your husband. So can you talk a little bit, because actually, even though this is a group for women, a lot of times what happens is, women get on this plan. Most of the time their husbands or their spouses, their partners are resistant. But then when they do get on board, big changes happen. So can you tell me what happened with him in terms of his skin issues?
Yeah, Dan has really significant psoriasis in various areas. And it's really always been, the whole time I've known him, it's been very angry and red and bleeding. So I've been trying and working with him to get more onto this plant-based diet, and he is more and more going that way. But when he really kind of started diving in and doing it, I would say it wasn't even maybe about 10 days into it. All of a sudden he was like, look at my skin. And I looked, and it was incredible. It is still there, but it was not open and red and bleeding. I even sent Lori pictures of it.
I was amazed. Yeah.
It was absolutely amazing. And I know that if he would just do this full on, that it would go away even more. And he's gone to the dermatologist, I don't know how many times since we've been together, and been on so many different medications that didn't do a thing.
Right. And LT actually talked about this early on too, with the skin issue that you had. Can you remind everyone about that?
Yes, I had a rash under my arm for the better part of 10 years that I had seen everybody about, specialized dermatologists, many of them, not to mention my OBGYN and my GP and my cardiologist and the pharmacists that we're friends with. And I said, even the neighbor down the street, I'm like, look at this arm. What is it? I mean, I just could not get rid of it. And it was bright red. And just within a few months of being on this, I would say about the 2.5-month mark, I started noticing significant changes. And now it is completely gone and is totally flesh tone like the rest of my skin. Completely gone.
It's amazing the way that inflammation comes out in your body. It really is according to your genetic markers, but it can be changed with lifestyle. When you change your lifestyle, you can reverse these things that you thought, well, this is just part of me. This is just the way I am, or the way my family is. It does not have to be that way. And for me also, this leads into, like I was talking about with the allergies, because I had to get allergy shots as a kid, and I was just sort of sickly until I changed my diet. I would get sinusitis and bronchitis every single year, twice a year usually. And also I have asthma from bacterial pneumonia. And I was able to, not only do I not get sick like that anymore, I haven't had sinusitis and bronchitis in at least, oh my gosh, it's got to be 15 years now. And I was getting it every year, twice a year when the weather would change. But also my asthma. I am able to run. And my doctor said that I thought about getting an inhaler when I started running, because it's easier for me, but I do have asthma. So I was like, should I get an inhaler, And they did a test on me, and he said, actually between your diet and your running, your lung capacity is more improved by that. Because they did a breathing treatment on me with the medicine, and they said the medicine doesn't do as well as they tested me after a run. They said, you're actually better with that. So, it really is amazing what can happen. Inflammation shows up in ways that you didn't expect. Because I'm sure, Linda D, were you even thinking because that wasn't even the reason why you were trying to get him on a plant-based diet. So were you even thinking about the skin issues when?
No, not at all. And I didn't notice it until he noticed it. Yeah, it really is crazy. So and again, so when you talk about inflammation, one of the main things that I hear constantly is the joint pain and inflammation. Just across the board. And again, so for those of you out in Facebook land or YouTube land, wherever you're listening to this, feel free to make comments.
but I know that you, April, that was a huge difference for you. So can you talk a little bit about the issues you were having before you came into the program?
Yep. So I started running. I just jumped right into a triathlon because I thought that was the smart thing to do. So started out that way, and I was like, wow, a 5K is really a long distance. And I would have to literally, which you're not supposed to do, so please don't do this, but I would have to start out my run with ibuprofen. I have technically I've been diagnosed with 3 herniated discs, 2 bulging discs, and I've had 3 knee surgeries. So the inflammation, the joint pain was pretty significant. And if I didn't start out my run with the Motrin, it made it really tough. And this was just 3 miles, but it would make it really tough just to get through even that first mile. So this wasn't even something that I was thinking about when I contacted you. Like, that wasn't even a thought process. But it was a pretty quick turnaround time before I realized, I was like, I haven't taken any Motrin. Now I'm running half marathons and
That's
I don't
amazing.
have to use it. Yeah.
Really,
and a little baby carrier, I might add. I mean, she runs with that little baby.
Right. Yes, April has pictures of herself running with her grandbaby, who is a chunk, by the way. He's not a little, he is a chunk. Most adorable kid in the world. And she runs with him too. It's like wrecking. She's got this big pack on. So yeah, that's amazing. Yeah, it's the things that you don't even realize, or you just accept that your quality of life is less. You're settling without even really thinking about it. And a lot of women do.
Sorry, Lori. No, because those were things I was diagnosed with. So I just assumed I was given the option of surgery or deal with it. And I didn't want to do the surgery because I'm skeptical of back surgery. I just wasn't about that. So I was like, nope, I'm just going to try to do this on my own and I'll deal with it. And there were days I would have to have my daughter put on my socks for me because I couldn't bend over.
Yeah.
I blew out my back brushing my teeth one day, literally just arched enough that I was brushing my teeth over the sink and I felt my back go out.
Yeah.
So
it really is. I posted a testimonial a couple days ago from Holly in our group, who has only been on the program for 2 weeks and said something really similar, that she was having extreme back pain for years. And even something I posted this morning about Cindy and her wrist, her son was like, how come you haven't been wearing your brace? Like, these are quality of life issues. These are the things like I said, like, yes, these women all of us have lost weight, and that's amazing. No, everyone wants that. But when people contact me, that's usually they're talking about that particular symptom. But there are so many other things that this affects. And what about, I know, Joanne, that was a big thing for you, was the joint pain and inflammation as well.
The inflammation, well, I didn't know it was inflammation, but I was getting injured all the time. And like silly stuff, like April said, brushing your teeth and just doing that one. I would do it every time I was taking towels out of the washer to put in the dryer. There went my back, or, just any small move, or it was either my back or my sciatic. And it was so crippling that I would just sit right where I was at and not be able to move. And then with the inflammation, I have had plantar fasciitis since high school, because I was in sports in high school, and I can always remember just such excruciating pain. And I always just thought it was from cheap shoes. But turns out years later, so about 2 years before I contacted you, I had torn my plantar fascia ligament, and I didn't realize it was torn because I was so used to extreme pain that when I tore it, I was crawling around my house. I was literally just crawling, or I would park myself in one spot and not move all day because the pain was so through the roof. So when I finally did go to the foot doctor, he took an x-ray and he said, it's torn. You're not going to like that news because now you're in a boot. but he showed me the inflammation of my ligament. And he said, this is why. You also have heel spurs or bone spurs on both heels. And here's why you have that, because look at how inflamed your ligament was. And it was probably 3 times the size it was supposed to be. And he told me, he's like, you have to lose weight. But I was in so much pain. I was in a boot. I felt like crap from fatigue. How was I going to lose weight with a boot up to my knee? So after that went away, and then I contacted you and got on this, I haven't had any pain in my foot. I can walk around barefoot now and I don't have pain. I've done 3 5Ks in sandals mostly. The pain is gone. Like the pain is gone. And I don't ever worry about it coming back.
Yeah.
So it's
Joanne
kind
is
of just freaky.
Joanne's a Birkenstocks girl for you.
Yes.
Fans out there. She talks about this a lot. I'm mostly in here over with the Crocs on because of these pigs. So anybody who spends any time out with their animals in the mud, then Crocs is the thing. But yeah, so again, that is, and I know that LT, you were in a boot as well.
I was in a boot because I had injured my foot. It was really my toe, and I had dropped a box on it years and years ago where the corner of the box hit my 4th toe. And it was to the point where I had learned to limp. I had learned to put weight on a different way. I'd learned a different way of walking, which, as you know, that's going to hurt your hip. That's going to hurt your back. And that's just kind of the way I had become. So I was in a boot at the particular time that I called you, and on the cusp of turning 50. Right when COVID started. And I still did it. So, you think about all the challenges, but everything started falling in line very, very quickly. And this was with a bulk of my weight to lose, and I still felt better. And now that the bulk is gone, it's just through the roof.
Yeah.
Mm-hmm.
Yeah.
Yeah, when I had, as you guys know, I tell my story a lot. I had tendonitis and bursitis in all my joints. And I was getting shots in my hips and in my elbows. My thumb was frozen in place. So like I couldn't move it around. And they did one of those really huge needles where they dig. I don't know if you guys have ever had this. It's horrific. They actually numb you before they put the needle in, and they dig around in that joint to try to get it loosened up with steroids. And so it was horrible. I couldn't sleep on my side because my hips hurt so much. And so not to have, I remember, okay, so this started when I was 35. I remember someone laughing at me. He thought it was funny. It wasn't in a mean way, but he said I looked like an elderly person getting out of my car. Because it was like one of those things where I'm like, you know how that is. It's like, I can remember if I was sitting on like a hard bench or something, I would get up and I would be bent over for a few steps because I'd have to try to just not to, that does a number on your psyche too. When you feel that way all the time, you feel old.
You feel slow.
Yeah. Yeah. And so I just know that's, one of the main things that I hear a lot is about the joint pain. So, and Linda B, you can jump into with any time that I know there's something very specific she's here to talk about, but you feel free to jump in with any of this stuff too. So the other thing though, mentioning slow with Joanne is the brain fog. And, my grandma died of early onset Alzheimer's, brought on by heart disease. And it was just a horrific thing. And so when I started getting this brain fog, I was terrified. I thought, well, this is it. I'm going to be going into early onset Alzheimer's, just like my grandma. And I mean, it's one of the scariest things that you feel like you're just losing it when you cannot place certain words. I mean, it just becomes a very simple thing. And I know some of you have experienced that as well. And I know, Joanne, you specifically, but anyone else who wants to talk about it too, because I hear that's another one that I hear all the time.
Yeah, I asked the doctor. I went to the doctor specifically because I thought I was having early onset Alzheimer's, because generally I have a very good memory, and I felt like I was losing my mind. I couldn't remember things with the kids' school. I couldn't remember I mean, just even just simple stuff. I just could not even think straight at all. And it was to the point where I was recognizing it being abnormal. And it was very, very scary. And it was all brain fog because I don't have any of that now. It's
Yeah.
just completely gone. And I actually feel a lot quicker, witted. And I feel a lot, like I can think about bigger things and more critical thinking, where all of that before it was completely just gone.
Yeah. It is a really scary feeling. Have
Mhm.
any of the rest of you experienced any relief from that? Or maybe you didn't have it before.
I would say that I had a negative way of thinking that made me kind of a sadness. And it just was a bent towards looking at things that were more that happened to me. And so to me, that's a kind of brain fog because I stayed in that little area of just something's going wrong, something's happening and I can't fix it and it's happening to me. And now I just feel like that I'm the one driving the bus on all of the thoughts, that I'm clear. I know what I'm saying. I know where I'm going, and when you have that lifted, that in itself is just a benefit alone that is worth all of it.
Right.
Not to mention all these other ones that I have.
So the bulk of your serotonin is produced in your gut as well. And so that is why, if your gut is not functioning properly, serotonin is one of those chemicals that they've shown that is, puts you just basically on a level playing field with the rest of the world. And so in addition to all the good reasons, not feeling well, being inflamed, being really overweight, all of these things that you might be feeling down, that actually is a chemical issue that's usually going on with people who come to me, and that I really dealt with. It is, I was profoundly depressed. And you can have, like, I also had long-term depression, but I was on medication at the time. But this was just from being in that state where I was just in this trough that I felt like I couldn't get out of. And so again, that's something that I just, a lightness of spirit and a lifting of that is something that I hear across the board, which is huge right there, because anyone who's dealt with that kind of, ongoing depression and anxiety, that is crippling. And it weighs on you also after a long time. It starts to weigh you down just from the fact that you've been dealing with it for so long. And something that we do, we do that, the mindset work, a lot of that in the group to help you get out of that as well. But there is a physical component to that. And so that's, for so many of us, that, that's worth the price of admission right there. Not to just be feeling that way all the time. Gina says, Joanne, I'm so happy that you don't have the pain in your feet anymore. I have a friend that has plantar fasciitis. I've been trying to get her to go plant-based. I'm going to let her know today about how good you feel. So, yeah, that is huge.
It's life-changing. It really is life-changing.
Yeah, all of these things, like we just, and that's, so I just want to point out again that I think all of you came to me asking about weight loss. And these are the side effects that you're having that are in addition to the weight loss that are really life-changing. So now I do want to talk to you, Linda B, about diabetes. And, it's lots of clinical studies have shown that a plant-based diet has a huge effect on both diabetes and heart disease. And it's because of the saturated fat that's in animal products and the processed foods that we're consuming are leading to these two diseases. And that's, the standard American diet is about 70% processed food, about 25% meat and dairy and eggs, and only about 5 or 6% actual produce. So fruits and vegetables. So it is no surprise that we have a huge amount of disease we are leading the world in things like cancers and of course heart disease and diabetes. So I go I have a different videos where I go into the science, which is, but in a nutshell, for diabetes, it is basically your insulin receptors get clogged with all of this stuff. It's similar to the way that your arteries get clogged. So things come out in different ways, again, depending on your genetic markers. But your insulin receptors get clogged. And so when they say you have high blood sugar, it's because that insulin can't get into your cell, and that's fuel for your cell. So that is, it's not the fact that necessarily that you're eating too much sugar. It's just the fact that this insulin can't get into your cells. And so it's floating around in your blood, and this is what causes problems. So that's just kind of it in a nutshell. And if you have diabetes, I'm happy to tag you in a video that I did that explains that in more detail. But what we're seeing with a plant-based diet in clinical studies and from doctors, and you can go to the Physicians Committee for Responsible Medicine, pcrm.org, to learn more about the actual studies, is that not only can diabetes be affected positively with a plant-based diet, but can actually be reversed. So, Linda, I wanted you to say what your expectations were and where you were coming into the program and what has happened since.
Coming into the program, I knew that this would help me overcome some of my conditions I've been managing for years, and diabetes was one of them. Hypertension I've had since I was in my 30s. And so I knew coming in, since, like you said, I'd been following you around a little bit prior to joining your program. I've known of you and met you a couple of times, and I knew from things you had said to me that it was the way to go. And so my expectations were high, but of myself, I didn't have any confidence. And I was drinking wine a lot, which I don't believe I had a problem with wine, but I did love it. I still love it. But, just even at the beginning when I started, my hemoglobin A1C, which is a measurement of your blood sugar over a 3-month period, it should be below 7, below 6, depends on what your doctor tells you. My doctor wanted mine to be below 7, but I had better expectations of myself. But mine was a 10. And so I know you can look that up to say, like, what did that average out your blood sugar to be, your fasting blood sugar? And it's huge. It's way too high. And it affects your organs and your body. And I was on medication, which I didn't want to be on. And one of my goals with your program was to get off my medication. And I am off my medication. My last hemoglobin A1C was at 5.5, which I never expected in a million years. I was jumping up and down for joy because he had cut my medication down, and I always at my doctor's agreeance. In other words, I would come to her and I would say, well, is it time for me to cut my medicine down, and talk to me about how we're going to do this? And I brought it up every single visit. And finally she was like, well, I guess you're off your diabetic medicine now.
Wow.
And and at that time she also reduced my blood pressure medicine, which that right there, I didn't think was going to be possible. I had been told, oh, you're never going to get off your blood pressure medicine. You're never going to get off of that. I'm doing it. I am off my water pill. I was on a water pill for many years. I'm talking like 25 years. And I couldn't sit at originally, one of my cardiologists said, oh, you can stop taking that water pill. This is probably about 15 years ago. And within 2 days, my ankles were swollen. I felt like I was getting fluid in my lungs, and I called him and I was like, why is this happening? Oh, just go back on it. Your body's dependent on it. You need to stay on it. My body was not dependent. I started a plant-based diet and was able to get off of that water pill. I have no swelling issues, no breathing issues.
Wow.
It's
I mean,
really
I'm
unbelievable.
amazed at how all of you and me and many others have turned around our health issues.
Mm-hmm. Yeah.
You know, coming into this, I wanted to lose weight. I still want to lose weight. I'm not perfect in this program. I'd like to think I can be, but nobody's perfect.
Mm-hmm.
In order to live our lives, we have to allow, like Lori's program allows for that, allows for some indulgences. And I'm just here to tell you, I'm not perfect. I have a glass of wine every now and then. I don't do it every day. And I'm amazed at the results. I'm one who hasn't lost, like with Linda D, lost 67 pounds. I've probably lost 30 in the year plus I've been on the program, and I've beat myself up for that. I'm here to say, stop doing that.
Mm-hmm.
I have gained so much more from this program than what I've lost up here
Mm-hmm. Yep.
and in here. So
It's so exciting. It really, there's such a sense of independence,
Mm-hmm.
you know, when you're not on all that medication. It really is. Now, and I have to ask too, did any of your doctors recommend a plant-based diet? And if not, what did they think of, what are they saying to you about all this?
well, my primary care provider is a woman. When I first said to her, this is what I'm going to do, I'm going on a plant-based diet, she kind of laughed a little bit, and then she said, oh, one of my partners is doing that too. So when she's like, it's fine, you know, of course, she wasn't going to ever say to me, don't do it.
Yeah.
Mm-hmm.
But she said, I don't want you to go to too many extremes. It's too hard to keep up with, blah, blah. She thought it was it's like that cartoon that you see where there's people in line for the pills, but nobody in line for the plant-based diet.
Right.
It's just like that. She was like, don't be too extreme and don't go down the extreme road. I said, oh, you know, I'm whatever. So, you know, as the months went on and I lost some weight and all my numbers were getting better almost right away, she was like, well, this is really working for you. I think she didn't believe I could stick with it.
Yeah.
But she said it was working for her partner too, but she's resistant to do it, even though she's significantly overweight. She said, well, I'm going to do intermittent fasting instead. So, I mean, she couldn't give up her, what did she tell me? She couldn't give up chicken wings and nuggets or something like that with her. Oh, and they always have sweets in the house. You know, his little kids.
Yeah.
But anyway, yeah, I don't think she believed it would work. And now that she sees it happening, I think she's opened her eyes a little bit too.
Yeah. That's good. And here's the thing about the medical industry. At first, I want to say that, you know, with all of my clients, they are working with doctors when they manage these conditions. I am not managing their conditions for them. But I always encourage, you know, my clients to ask questions of their doctors, to ask questions, especially about titrating their meds, because if you're not communicating with your doctor about what you're doing, they may not realize that you need to titrate down. And so, you know, I think it's so important to be communicating with your physician when you start something like this, because you should be able to get off of your medications, or at least reduce them. But that being said, the average doctor has less than 72 hours of nutrition training in their entire schooling. And that includes, you know, usually that's 8 to 10 years or something of schooling and internship and all these things. They don't have it. And so there's a good chance that your doctor does not know. But what's unfortunate is they can still give nutritional advice, even though they're not trained in it, because they're a doctor. And so that's why you have these doctors out there saying, oh, you should try keto and these different things. And then people come to me and say, well, I tried keto, my doctor suggested it, but now I have gout and my cholesterol went through the roof. My diabetes is worse. So it's important also to talk to someone who knows about nutrition, and, you know, not, no offense to anyone, but not your Beachbody coach, not somebody who, you know, because anybody can say like, oh, I'm a Beachbody nutritionist, or I'm this, or I'm that. someone who actually is trained. It's important. But I mean, I'm so happy for you. Gina says, great news, Linda. Love hearing everyone's stories. It really is. It's so empowering when you can get off your medications. It really, you don't realize how it makes you feel mentally to be on all of those meds until you can get off of them.
Mm-hmm.
So that is really incredible. And I know in terms of blood pressure, at least I know, Joanne, you have a story about the blood pressure. Do you want to mention about that?
Yeah, so I was on probably the same blood pressure medicine that Linda was on, but I was prescribed it for migraines because it's a beta blocker, but it relaxes your blood vessels. So it did treat my migraines in the beginning. It made a big difference for me, but I've been on it for, years.
How many, can you say that again, Joanne? How many years were you on it?
Okay, sorry.
That's okay.
I was on it for 12 years. Yeah, and so when I to the doctor and he said I could sort of start to taper off of it. And so it lowers your blood pressure, but my blood pressure kind of evened out at a certain point. Well, after I went off of the blood pressure medication or the migraine medication, and I went to my OBGYN, my blood pressure was actually lower than it had stopped being lowered by that medication. So I think I was actually having inflammation from the medication as a side effect. And it was making me so tired and so sluggish that, you know, even when you just stand up out of a chair, you have to give yourself a second because you get a little woozy. Now I don't have any of that. I'm so glad to be off of it because what a downer it was for all those years.
And again, that's something that you just assumed you'd have to always be on.
Right,
Whenever
right.
anybody tells me this stuff, they're like, you're not going to believe this, but because they weren't expecting it either.
Right.
And that is really an incredible result. And you mentioned your OBGYN. I know that LT, you have a story about an OBGYN.
I do. I just went for my annual checkup just a couple of weeks ago, and you know, I had not seen her since last year, and so my numbers look different this year when she was looking at my chart, you know, before the exam. And also one thing that was different too is they had, at this particular office, they had a wellness questions with about 10 questions. And it was things like, are you feeling depressed or anxious? Are your eating habits changed? Have you isolated? And I know that a lot of it was in light of COVID and asking, but I was a 0 down the board. So I had none of that. And so she saw that and then saw my numbers, and she really praised me for doing a plant-based diet because I told her that that was what the difference was, because she did ask. And then before she left the room, she turned to me and said, I just really want to commend you on having your act together when seemingly this world is falling apart. Mm-hmm. And so I just thought that was high praise.
That's awesome.
Yeah.
Mm-hmm.
Yeah, it really does. You know, my doctor, I think he's almost exasperated at how healthy I am. he's like, well, I'll see you next year, because I go in and get a yearly checkup. And so, but yeah, it's like he does always say to me, he's like, you know, keep doing what you're doing. He's like, and keep putting the message out, because he knows what I do.
I had another doctor's appointment just about 6 months ago, and this was with my cardiologist because I have a strong family history of heart disease.
Yeah.
And my dad died a year and a half ago with heart disease, and then the women on my dad's side have that problem. So I had been plugged in with a cardiologist for a while. So about 6 months ago, it was time for me to do my echo. And I was only just barely 5 months into this program by then, you know, and my echo had dramatic results. Even he looked down at the chart and then looked up at me and he said, your echo looks amazing. What are you doing? And I said, well, I have started eating a whole food plant-based diet. And he said, the ultimate. And I said, it is, isn't it? And he said, yes. And so that's the inflammation. I mean, that is the lining of your heart. So you're talking about the lining of my heart had improved when I already have this big overriding family, strong history. So that gave me true peace of mind and knowing that I'm really going in the right direction with this.
Mm-hmm.
Right. And as I've told you guys, I have an extreme heart disease history in my family as well. My grandma had her first heart attack and open heart surgery at 47. Yeah. Her triglycerides at that point were in the quadruple digits.
Yes, my dad was 42 when he had his first quadruple bypass, and then he had it again 20 years later at age 62.
Yes.
And
So
he said
what
there
they-
would not be a third one. That surgery is rigorous because
It is
when he
awful.
was 42 years old, that's when they cut you from the groin to the ankle. And his second one, 20 years later, they just did that smaller incision. But yes, and it was
Yeah.
awful, and the way the changes that he went through with that, and it really
know.
affected our family forever. You know, it
That
really.
was that was the same thing. They told my grandma at that time that she would have to have another one at some point, and 10 years later she did.
Yeah.
But they didn't talk to you, and they still don't, many of them. That's what's really interesting is your doctor knew about a plant-based diet, but he had never mentioned that to you until you said to him, that's
Never.
what I'm doing.
I have
And
never
that's-
been told that. And with the rash and everything, and they never mentioned anything I was eating. It was always giving me a pill, a shot, or some kind of a cream or ointment or powder. I've tried them all.
Right. And so my cholesterol,
Yeah.
my cholesterol was 285, which is alarming too. And they tried to send, they were like, we're sending a heart monitor to your house. We want you to wear this 24/7. That was like the last straw for me. I'm like, you know what? My grandma went down this road. They were actually angry with me on the phone because I wouldn't take the medicine and wear the heart monitor. I was like, I got to figure this out because I'm not going down that road. But it dropped from 285 to 142 with no meds. And, people don't realize that there's only cholesterol in animal foods because mammals make cholesterol. So we make our own cholesterol. And then when we are consuming animals on top of that, we're consuming their cholesterol as well. So if it only makes sense that our cholesterol is going to go down when we get that stuff out of our diet, and we don't need it. We do not need it. And as you've heard today, all of these women are feeling amazing and having amazing results, and they're not dying of protein deficiency. Are any of you guys dying of protein deficiency?
The opposite.
Not at all.
No.
Right.
That's the thing, is it's like, that's the two things I get asked about constantly is where do you get your protein and where do you get your calcium? And so I've done tons of blogs and videos and different things on that. So I'm happy to talk to people about that if they want to know, but these are not things you're deficient in on a plant-based diet. And also the thyroid, I do want to quickly mention that. So the leptin that controls your thyroid is also produced in your belly. It actually is produced in belly fat. And so when you, gain this belly fat, you are overproducing leptin, and it affects your thyroid. So that's another one that I'm constantly hearing from women is thyroid issues. And maybe last week or so, I put up a picture of before and after of Carla. So I just wanted to read really quickly because you guys can scroll back and look at that. But she's in 5 months. She lost 26 pounds, 36 and a half inches, 12 and a half inches of that, was from her waist. She completely got off of her blood pressure medicine, cut her cholesterol meds in half, and has decreased her thyroid medication. And that's just in 5 months.
Amazing.
So she said she's 60 too. So there's this thing that is, once you get past a certain age, like a lot of women will say to me, it's just harder now because I'm older. And I'm not gonna say that's not true. Our metabolism does change, but that doesn't mean you can't get the weight off, and it doesn't mean you can't have amazing results.
And Lori, Carla is in my run group and is doing amazing.
Yay! I totally. Oh my God, that's one of you guys, and I can't remember if it was you or Joanne, but somebody mentioned to me that she was like a complete dynamo, which is
she is amazing.
She is.
Yeah, she's doing great.
That's so exciting. So is there any any final words that any of you want to say?
I do have something to say. On the heels of, starting the program, and I reached out to you solely weight-based. I have tried everything, and actually we talked about this last night because I have done the Beachbody, and I've done the Thrive, and I've done the this, and I've done the that. And, you know, maybe you lose a handful of pounds, but they just come rearing right back. And so, yes, when I reached out to you, it was really just weight-based. The transformation that takes place that has nothing to do with weight, the confidence, the security in yourself, just waking up and not having that clouded feeling, that doldrums. You know, I hate to say it, but everybody's talked about how bad quarantine has been. And I'm like, I'm good. Like, I'm still out. I'm running and I'm doing my thing and I'm losing weight. I feel amazing and I'm okay. So I think it's not just about the weight, that full body transformation, that mental transformation that takes place is a huge part of this.
Yeah. So, and it's hard to get that across when you, like, for any of you, let me ask you guys this question. So if when you guys came to me, and I know I preach this a lot, but when you came to me, if I would have said, you know, this really, the weight loss isn't going to be your focus. When you're going to lose the weight, but that's not going to be your focus. Would you have believed me?
No.
Yeah.
That's all I could think about. That's what I was consumed with, numbers and sizes and chasing the scale and being up and down and up and down.
Yeah.
So I couldn't have dreamt this big because I didn't know it was.
Right. Right.
You know, and I think sometimes
for me, I had, go ahead, April.
Okay, go ahead, Shane. I was just going to say, I think for a lot of us too, we go into it skeptical because we've tried all the things. So we're already reserved coming into it, thinking, how is this possibly going to work for me? Like, I can't eat salad all day. And it's so much bigger than that.
And plus, we're hardly ever eating salad. And that's the funny thing is all the food that we post, like salad is about 5% of what people post on in our group. What were you going to say, Joanne?
Oh.
Well, I was going to say that prior to finding you, about 2 years before that, the doctor that I had gone to, because I thought I had MS, because I thought I had early onset Alzheimer's, because every single thing I went to him going, why do I have this? Why can't I do these things? Or why do I feel like I'm dying? And he just kept saying, well, you're fine. Your levels are fine. Everything's fine. Well, on the last appointment that I went to him before I joined the group, I had gained I was just kept going up in weight. And he said, and I've known him for 15 plus years. And he said, don't take this personally, but on your, the little chart they give you to take out to the front, he wrote obesity. And he said, I'm sorry, don't take this personally, but your diagnosis is obesity. And so he gave me that, but he gave me nothing. He said, lose some weight. And then when I went to the foot doctor with my torn ligament, he said, you have to lose some weight. And so I just felt like I have to lose some weight. And I had no idea. So I went back to that doctor last August, back to my primary care physician. And at that point, I had lost 40 pounds and he did a double take and he's like, what are you doing? And I said, I switched to a whole food plant-based diet. And then we went over the whole thing. And the thing he said to me was, I've always known that was the best route to go. And I thought, for 10 years, I've been coming to you and the last thing you called me was obese. And I said, you know what? And he's kind of chunky himself and he's always limping. He's got knee issues. I said, I'm coming back on my next year appointment and I want to see some changes in you. If you know that that's what the best way to do it.
Right. Then why aren't you doing it?
Right.
Yeah. Yeah. His head was spinning. I'm like, right. For 10 years.
It's so frustrating. I had a woman who had endometriosis. This was years ago when I, more towards the beginning of when I started the program. And she had been struggling for many, many years to the point where she was a high school principal and she would miss usually at least 3 days of work every month because of it. Like when she would get her cycle, it would just take her out. And so they told her she was going to have at some point a total hysterectomy. And I said to her, just do my program. Let's do it for 6 months. Because this was I think they told her this in June. and she scheduled it for December because she wanted to have the procedure while she was off for Christmas. I said, let's just take these 6 months and see if this makes a difference. It's not going to hurt you, and you could possibly avoid this. So let's just see what happens. So she did my plan for 6 months. They didn't check her before. She didn't tell them what she was doing. They didn't check her before that she was supposed to go into surgery. So she wakes up from the anesthesia and they said, we did not give you a hysterectomy. What have you been doing? It's totally different. Like, you don't need a hysterectomy now. What happened? And she said, well, I've been following this program, this whole food plant-based diet. And in her case, we also did gluten-free. And he said, I've heard that that was the best way to go. And she was like really excited, but I was pissed. I was like, what do you mean if he would have said that to me, I honestly think my head would have exploded. My brains would have just splattered all over the room. I would have been like, are you kidding me? So it is really frustrating. But the thing that I want to put out there is that two things really which is that there is hope, and it's exciting. It's exciting to get your life back. And like April said, not just physically, but up here, to feel like you have your mojo again. There is just amazing. But also, it's not any plant-based diet. So that's the other thing. I just want to make sure that you guys know that all of these women are on my program. And I get plenty of women coming to me saying, I've heard a plant-based diet is great. So I've been doing it for this many months and nothing has happened. So there is, like everything else in the world, there is a right way and a wrong way to do it. Mm-hmm. And so I encourage all of you who are interested in having these types of results. And you may, again, you might just be focused on weight loss, because that's what the thing that, we're so like, that's the symptom that we can't get away from, that we're always looking to change. But it's so much more than that. It's weight loss and so much more. Is there anything that anybody else wants to say before we sign off?
I just want to say that I want to echo something that April said. I think that, the emotional part of it, I never expected. I was in such a severe, deep depression for many, many years, and like you, on medication, and anxiety was just crippling. And coming into this program, because we had some talks about how I was like LT, where I thought everything was happening to me, and everything anybody said to me was directed at me. And you learn that people's attitude is all about them and not about you. And coming through that, like, you're not the fattest girl in the room, and you're not you know what I mean? It's all of that mindset. Right. That's so much bigger.
Yeah, that wasn't my focus today, but that is a huge part of what we do in the program. And we focus on personal empowerment, because I realized many, many years ago that I did not feel empowered, and that more than anything else, that sort of, I won't say helplessness, but almost it was almost like you said, things are happening to me. I have no control. Right. Feeling like that is awful. And so when you get into an environment like we have in the Plant Power Army, where you have just so much unconditional support, so much cheering on for all of your victories, and you can post, and you've done that too, Linda, where you've posted like, I'm having a crappy day, and here's what's going on, and whether you post that I'm having an amazing day and this amazing thing happens, you're going to get 20, 30 people saying you are a rock star. If you're saying, I'm having a horrible day and this is what's going on, you're going to get 30 people saying you are a rock star. And you can do this, and I've been there, and I'm here for you. And so that in and of itself, to have that kind of tribe, and especially when we're all working on empowerment, it is transformational. So I appreciate you guys bringing that up. So I just want to thank everyone who, first of all, I want to thank all of you for joining me today. As anyone out in the world knows, getting anybody together for any meeting, especially when it's 6 busy women, it's a feat in and of itself. So I really appreciate you guys coming on board and talking about this. I know that it means a lot to the people who are watching. And to those of you who are watching or who are watching the replay, we encourage you to ask questions, to post comments, and of course, you can feel free to reach out to any of us about the Plant Power Revolution program and what it can do for you. So Gina says, I want to thank all of you today for sharing your stories, great topics. I've been doing a plant-based diet since 2011, not perfect all the time, but since I've been following this group on Fridays, I am doing much better and feel great. That is amazing. Awesome. So that's the thing, is we all talk about how this lifestyle filters out into everyone in your world and affects everyone positively. And before we go, April, I see that your Christmas tree is still up, and I know that you are a big fan of Christmas, but what is happening back there? Has it turned into like a Valentine's tree and then what
are you talking about, Lori? What do you mean? What are you talking about? We just talked about this last night, how I have such a struggle letting go, and Linda D is here with me. It's just that whole ambiance of it, and it's just so chill and relaxing when I come home and it's dark, it's getting to be dusk and I can just have my lights on. And forgive me if you can hear my grandson over there. He's making googly eyes at me. It's still up, Lori, and I'm catching a lot of flack over here. So the husband's telling me that it's coming down this weekend. There's actually 3 of them.
Oh, so, wow. Yeah, that's hardcore. But I say you just decorate them with like St. Patty's Day,
I tried to go there. I tried. He's not buying it. Nope, he's not buying it.
I still have mine up too. And my favorite thing to do at night is to turn all my lights off and just have my Christmas tree lights on. And then I do yoga.
Yeah, that's so cool.
I think it's mentally good.
It is. I think, and you know what? I honestly think that one thing that is one good thing that has come out of COVID is that people feel more freedom just to do their thing with stuff like this. It's like that, if that makes you feel good, then go for it.
Exactly.
Yeah. Yeah. Tell your hubs. That's my opinion on it. I'm sure he'll take that very seriously.
He will. Don't worry. He will.
All right. Well, thank you guys so much for coming. And we will see you again next week for the InnerStrength Empowerment Hour. Have a great day.
Bye. Bye.